This is a story about a COVID-19 medication, a nasty trick the coronavirus sometimes plays on its victims, and how the two became a pandemic couple called Paxlovid Rebound. It's also a story about how looks can be deceiving. Americans have been quick to embrace the idea that the antiviral drug is to blame for COVID-19 relapses in people just days after they've seemingly recovered. President Biden was said to have experienced Paxlovid rebound this summer, after White House doctors declared him coronavirus-free. The same thing happened to Dr. Anthony Fauci and Stephen Colbert, among others. It's tempting to presume a cause and effect relationship between two things that occur in quick succession. And even when events are completely random, we tend to see the patterns we expect to find. But researchers are not so sure Paxlovid rebound is real. Relapses have occurred in COVID-19 patients who didn't take the drug, they just didn't get as much attention when there wasn't a new medicine to blame. Doctors fear some patients who could benefit from Paxlovid are skipping it in an effort to avoid a boomerang bout of COVID-19. That's troubling because the medication has been found to powerfully reduce the risk of hospitalization or death in the unvaccinated, older people and those with compromised immunity. Preliminary research hints it may even reduce the risk of long COVID. Dr. Charness, who led a team that exhaustively studied 13 patients whose COVID-19 rebounded, admitted that the phenomenon has scientists scratching our heads. He said he's perplexed that many rebounders' viral loads, and thus, their ability to infect others, can be just as high or higher than it was during their initial illness. But rebound is not a reason to not take Paxlovid, he insisted. When used by people with a good chance of becoming severely ill or dying, Paxlovid reduces the odds of either by almost 90%. Moreover, passing on Paxlovid out of concern that it will prompt a 1-2 punch of COVID-19 is unlikely to help, Charness said. It's clear some people will rebound anyway, he said. That wasn't so clear in late May, when the Centers for Disease Control and Prevention issued a health advisory titled COVID Rebound After Paxlovid Treatment. It informed doctors and public health officials of recent cases in which people who had taken the recommended 5-day course of Paxlovid and then tested negative for a coronavirus infection had recurrent illness 2 to 8 days later.